This is a paid advertisement.
Welcome back to the Noon Show, and welcome to Ask the Expert on WBAY TV2. Dr. Patel joins us today from Tower Clock Eye Center. It's great to see you, Doctor. Thanks for being here.
Thank you.
Aging and changes to the eye, they can happen not only to the physical eye, but the surrounding tissues as well, like your eyelids, for example. Is eyelid drooping something that you would deal with as an eye surgeon?
Yeah, absolutely. So if the eyelid drooping is getting in the way of the vision, we're happy to help out and see if we can pick the eyelids up a little bit so that you can see better.
It really can affect the vision. It's not just a cosmetic procedure, right?
Oh, absolutely. A lot of people will say that it's difficult to see over top of their eyelids. And you can imagine that if your eyelids are drooping to the point where your pupil's covered up, you can't really see much of anything. So if it's getting in the way, we can usually get some insurance approval to go ahead and get the surgery done.
What is the actual surgical approach to eyelid drooping?
So the most common procedure that we do is called a blepharoplasty. And that blepharoplasty is basically the removal of excess skin that is hanging over the actual meaty part of the eyelid. And the surgery is done pretty straightforward, a couple of little incisions and then some sutures to close things back up real nicely.
Are there other issues with an eyelid that could be handled surgically, not just the blepharoplasty, for example?
Oh, absolutely. Sometimes people will have problems with their lower eyelids where they might be turning out and not sitting flush on the eye, or they might be turning inwards, causing eyelashes to turn into the eye itself. These conditions can be uncomfortable and can also be dangerous, and so in those cases we can go ahead and try to get something done to fix it.
You mentioned insurance, and I know that's a really important factor for a lot of folks when they're facing something like surgery. Insurance will cover this if it's become a legitimate vision issue, right?
Oh, absolutely. So if the eyelids are getting in the way of the vision, usually what we'll do is do a consultation, talk to you about how we might be able to fix that. We'll get some testing done, and then while we're scheduling surgery, our office will be able to make sure that the insurance will cover it.
When it comes to the consultation itself, I think a lot of times people wait too long. When is the right time to come and see you if you're having eyelid issues?
Well, basically, if you're having trouble and you feel like the top of your vision is getting obstructed by your eyelids, maybe try at home to see if picking your eyelids up manually with your hands makes things better. And if it does, it might be time to go ahead and get seen to get something done about this.
Is waiting too long a factor? Can you wait too long in this case, or does that affect you at all?
No, it would probably be okay to wait. Basically, we can go ahead and do something about it when it's broken. So if you're having issues with it, it doesn't really make sense to wait and suffer through. You might as well just go ahead and get something done.
Absolutely. Go see the experts at Tower Clock Eye Center. Thanks so much for being here, Doctor. We appreciate it. If you've got any questions, you want to contact Tower Clock, that information is right there on your screen and always available at WBAY.com. We'll get you back into the Noon Show right after this.
The preceding was a paid advertisement.